This part of the DVD teaches you how to set the parenteral nutrition infusion. This will usually be the second stage of your training, and as before, it will be used in addition to face-to-face sessions. Put on a plastic apron and wash your hands with liquid soap and water using the 7-stage technique to make sure that every part of your hands are clean. Turn on the water and wet your hands. Apply the liquid soap. Rub your hands together using the following sequence and 3 to 5 good strokes of each action. Palm to palm with fingers interlocking, palm over the back of the hand with fingers interlocking, and then do the other hand. Rub the backs of the fingers into the palm. Rotational rubbing of fingers into palms on both hands. Rotational rubbing of thumbs clasped by the opposite hand and then swap hands. Finish by cleaning both wrists. Rinse thoroughly under running water and then turn the tap off. Use the paper towels to pat your hands and wrists until they are completely dry. It is important to make sure that your hands are dried completely so that your skin does not become sore, and dry skin is less likely to attract germs, viruses and other infective organisms from the air. If the CVC is visibly dirty, or you know that it has been contaminated, for example in bath water, with stool or vomit, cleanse the CVC using gauze swabs, a clean bowl, warm water and washing up liquid, as previously shown in part 1. If you are confident that the CVC is clean, you can proceed to prepare your trolley. Wash your hands as before, to make sure that if they were contaminated whilst cleaning the CVC, they are clean before you commence the procedure. Prepare the trolley as already shown, using washing up liquid and water. Wash, rinse and dry both surfaces of the trolley and any other smooth, hard surfaces that you will be using to put unopened equipment on. Clean the top surface of your trolley with a 70% alcohol wipe, using a side-to-side motion and covering the entire surface area. The alcohol must be allowed to air dry for at least 30 seconds, longer if it still looks wet. Alcohol must always be allowed to dry for it to kill germs, viruses and other infective organisms. Get all of the equipment that you will need for the procedure and place it on the bottom of your trolley or the other smooth hard surface area that you have cleaned. Check that the equipment packaging is not damaged in any way and does not appear to be or have been wet, which could mean that the contents are no longer sterile. Check that the expiry date is not passed. If there is any doubt that the contents of any of the packages may not be sterile, discard them. Check that the vials are not damaged in any way or leaking, and make sure that the contents label is correct and the expiry date is not passed. Check the infusion fluids to make sure that they contain the expected amount of fluid, are a similar colour as usual, and you cannot see any large particles in them. Check the label to make sure it has the correct child's name and date of birth on. Check that the expiry date is not passed, and check that the fluid volumes have not changed unexpectedly. Squeeze the bag to make sure that there are no small holes and tap to allow any small air bubbles in the fluid to come out into the top of the bag. This will help to avoid air in line once the infusion is running. Clean your hands with alcohol gel using the same 7-stage technique that you used for washing. Keep rubbing your hands together until the gel is completely evaporated and your hands are dry. Put on a pair of non-sterile gloves. Gloves should be left in the box where they will be protected from dust until you are ready to put them on. Place the bag containing the fat infusion on the trolley with the connection ports facing towards you. Using a CHG wipe, clean the connection port where it will break open for 10 to 15 seconds, ensuring adequate application of the alcohol and chlorhexidine. Leave this to air dry for at least 30 seconds, and longer if it looks wet, to ensure that any bacteria are killed. If necessary, move the bag so that the cleaned connection will not be at risk of contamination whilst you carry out the next part of the procedure. Place the giving set without the filter on the top of the trolley. Open the bowl and then the giving set. Make sure that the giving set is not twisted or knotted. Close the roller clamp. Put the end of the giving set into the bowl. Remove the cap from the connection port on the fat infusion bag, taking care not to touch the key part. Using a two-hand technique, remove the cover from the giving set spike. Join the giving set into the infusion bag, taking care not to touch the key parts or twist the giving set. Hang the bag on the infusion stand. Gently squeeze the giving set chamber until it is approximately half filled with fluid. Slowly release the roller clamp and allow the fluid to run through the giving set. Expel any air by allowing it to run upwards in the direction that the fluid is travelling. Once all of the air is removed and the giving set is fully primed, close the roller clamp. Place the aqueous bag on top of the trolley with the connection ports facing towards you. Using a CHG wipe, clean the connection port where it will break open for 10 to 15 seconds, ensuring adequate application of the alcohol and chlorhexidine. Leave this to air dry for at least 30 seconds, and longer if it looks wet. If necessary, move the bag so that the cleaned connection will not be at risk of contamination whilst you carry out the next part of the procedure. Carefully peel open the packaging containing the giving set with the filter, taking care not to let the giving set fall off the packaging and not to touch the central parts of the packaging or the exposed smart sites, which in this instance are the key parts. Throw away the paper label. Lift the giving set chamber off the paper, taking the spike and top portion of the set with it. The smart site left behind on the packaging is the part that you need to connect to the fat giving set. Taking care not to touch the key part and using a two-hand technique, remove the cap from the end of the fat infusion giving set and join it to the filter set. The remaining smart site is not a key part in this situation because it is not being used. Remove the paper ties and make sure that the sets are not tangled. Close the roller clamp. Place the end of the filter giving set into the bowl. Remove the cap from the connection port on the aqueous infusion bag, taking care not to touch the key part. Using a two-hand technique, remove the cover from the giving set spike. Join the giving set into the infusion bag, taking care not to touch the key parts or twist the giving set. Hang the bag on the infusion stand. Gently squeeze the giving set chamber until it is approximately half filled with fluid. Slowly release the roller clamp and allow the fluid to run through the giving set. As the fluid flows past the smart sites, you will need to invert the set and tap until the air is expelled. Continue along the set and expel any air by allowing it to run upwards in the direction that the fluid is travelling. As the fluid fills the filter, tap it in the palm of your hand to expel air. Once the fluid reaches the junction with the fat infusion, release the roller clamp on a fat infusion set and allow any remaining air to flow out. Close the roller clamps on both infusion sets to stop the fluids running. Open a pack of sterile gauze and place it on top of the trolley. Remove the end of the giving set from the bowl and use 1 or 2 pieces of the gauze to dry the end of the giving set. Put the dry giving set end on the trolley surface, remove the bowl and clean up any spillage. Clean the neck of the 0.9% sodium chloride ampoule at the point where it will break, using a CHG wipe for 10 to 15 seconds. Put the vial onto the top of the trolley without touching the key part that you have cleaned. Leave this to air dry for at least 30 seconds and longer if they still look wet, so that any bacteria are killed. Open the 10 ml syringe packaging by peeling apart from the plunger end to approximately halfway. Fold the packaging away from the syringe and place it between your thumb and forefinger, keeping the packaging tucked into your hands to prevent any accidental contamination of other equipment. Open the green needle in the same way, taking care not to touch the needle hub, which is an exposed key part. Join the syringe onto the needle as quickly as possible to keep the exposure time for the key parts to a minimum, taking care not to touch the needle hub. Put the syringe and needle on the trolley and throw the packaging away in the rubbish bag. Partially open the end cap packaging to allow easy access when it is needed. Cover back over and place it on your trolley. Remove the top of the 0.9% sodium chloride vial, taking care not to touch the area where it breaks. Put the vial back down onto the top of the trolley and throw the top away in the rubbish bag. Remove the green needle cover, leave the vial on the trolley surface and put the needle into the 0.9% sodium chloride vial and draw up at least 5 ml. Knock the air bubbles to the top of the syringe and then push the plunger to expel the air. Remove the needle and put it in the sharps bin. Take the end cap out of the packaging, taking care not to touch the part that will go onto the syringe. Put the prepared flush down on the trolley. Throw any remaining equipment or packaging that is not needed in the rubbish bag. Place 2 or 3 CHG wipes on top of the trolley. Remove gloves. Clean your hands with alcohol gel using the same 7-stage technique that you used for washing. Load the infusion sets into the pumps. Position the trolley and equipment near to the child. Clean your hands with alcohol gel using the same 7-stage technique that you used for washing. Put on a pair of non-sterile gloves. Using a CHG wipe, clean the CVC and catheter cap by rubbing for 10 to 15 seconds and making sure that there is good application of the solution to the connection. Hold the CVC, taking care not to touch the connection. Throw the wipe into the rubbish bag and allow the connection to dry for 30 seconds or longer if it still looks wet. Make sure that the CVC is clamped. Remove the catheter cap and throw it in the rubbish bag. Clean the exposed CVC hub using a CHG wipe for 10 to 15 seconds. Throw the CHG wipe into the rubbish bag. Allow the CVC hub to dry, taking care not to touch the hub and, if possible, keeping it pointing downwards so that dust cannot fall onto it. Using a two-hand technique, remove the end cap from the 0.9 sodium chloride syringe, taking care not to touch the key parts. Connect the syringe onto the CVC. Throw the end cap into the rubbish bag. Unclamp the CVC. Using a push-pause technique, inject the 0.9 sodium chloride into the CVC. Apply the clamp as the last half ml is being injected to create a positive pressure. Remove the sodium chloride syringe and throw it into the rubbish bag or onto the bottom of the trolley. Using a two-hand technique, remove the cap from the giving set and attach this securely to the CVC. Remove your gloves, alcohol-gel your hands, set the infusion running, dispose of all rubbish, clean and store equipment safely.